The theme for our annual report this year is making a difference 24/7, 365. And it was largely inspired by the young man that's in the room with us tonight, Andy Duran. Your township board and leadership elected to support Text-to-Tip, a program that Andy and his organization lead, helped us kick off on March the 14th, 2016. And not only are townships about serving people, we now are able to serve people 24/7, 365 through Text-to-Tip. Kids who may feel a little bit lonely, perhaps left out, confused, some worse, will now be able to get help through this important confidential service that we've recently launched. And we are very fortunate to have New Trier Township's newest partner, LEAD, which stands for Linking Efforts Against Drugs, represented by its founder, Mr. Andy Duran. Andy?
Great. I want to start with a story. My wife and I have this ritual that when we put our kids to bed in the evenings, at least as many nights as we can, we ask them about something that we see in their room. Now this might take the form of something we've seen 100 times. This might take the form of something that we saw for the first time. Anyway, a few months ago, I go in my daughter Grace's room. She's 6 years old, and I see this taped to the ceiling above her bed. So naturally, I have two immediate questions. Number one, how did that get there? And number two, why is it there? So I'll start with the first one. Grace, how did that get there? And she said in a very excited tone, "Oh, Daddy, I'm so excited. I put my chair on top of my bed, I climbed on top of it, I stood on my tippy toes, I reached as high as I could, and I stuck it up there with 2 pieces of tape." Okay, so follow-up question, where were her mother and I when this was going on? Question number two. Why is it there? Now, I'm expecting her to say something sort of simple, like, well, because helicopters are supposed to fly, so I put it up in the sky. But that's not what she says. She says, "I love that helicopter so much that I wanted it to be closer to me when I sleep." Okay, so I didn't have the heart to tell her she could just put it on the headboard and avoided the whole possible cracking her head open. But anyway, it went up on her ceiling, but it made me think about that conversation because so often we don't ask the question why of our young people. We have young people in this community who are struggling. We have young people in my community in Lake Forest who are struggling. And we as adults and community leaders and parents sometimes forget to ask why. You see, I think there's a big link between the way students and young people behave and what they believe and what they feel. And I use this analogy that says Y equals desire plus belief. In our communities, we have young people that are struggling, that are in pain, that are depressed, that are anxious, and they don't know what to do with those things. They desire those things to go away the same way you and I would. Some of them can cope with that pretty well in a healthy manner, but others can't. And young people are harming themselves. We have to ask why. Just under 4 years ago, I held a focus group in my office in Lake Forest, right after I had taken the job at LEAD. And I gathered a group of Lake Forest high school students, and I started with one really simple question. What is it that you need that you're not getting? And the responses to that were changed the way I thought about this for good. What is it that you need that you're not getting? Now, this was on the heels of 3 Lake Forest high school students committing suicide in a span of 87 days. 3 suicides in 87 days 4 springs ago. That doesn't happen. If you look in Lake Forest, not unlike many of the municipalities in New Trier Township, Kenilworth, Winnetka, Glencoe, these are great communities with caring families, with lots of education, with lots of resources, beautiful place to live. Who would think that that sort of thing happens in our backyard, right? But it does, and Lake Forest is not the only, Lake Forest and Lake Bluff are not the only communities to experience such things. So we pulled these students together and said, what is it that you need that you're not getting? And they just spit it out. What I came to realize is that young people have different vocabulary as it comes to mental health when they're using text versus when they're actually trying to have a conversation. And one young woman summed it up the best way I've ever had it sum up. I was asking them about how they use texting versus how they use conversation. And she said, I see a counselor every single week. I walk into her office, I say hello, we shut the door, I sit on her sofa, and for the next hour during our session, we only communicate via text. I sit on the sofa, my counselor sits on the chair, and the whole thing is done by text. Then when the hour is up, I get up, I say goodbye, I walk out the door, and then we repeat the same thing week after week after week. And I asked her, why is it that that's the case? And she said, because I don't like to talk about these things. But for young people, talking and texting are not the same thing. So I said, okay, well, what if we were to install some sort of text system where you could text your counselors or you could text a counselor on call any time of day? Is that something you would use? And they said yes. So I said, great. Focus group walked out, went to a meeting with community leaders and said, this is great. We're going to look into a service that probably already exists. We're going to raise some, a few $1,000 and we're going to bring it to town. Believe it or not, there was nothing like that. We did extensive research in the entire community that put all that. There's nothing like that anywhere that put all those pieces together. So what we did was we repurposed Crime Tips reporting software. We changed the way it functioned on the back end, and we came up with Execut, which to our knowledge is the only 24/7 text-based crisis hotline in the country that uses licensed mental health professionals. So I want to tell the story about that a little bit. Enter Execut. Execut has been launched in New Trier Township. As you've heard tonight, it officially launched on March 14th. We've had some little bit of usage and schools starting to communicate that it exists. However, you're going to really start to see that blow up in the next month because schools are now starting to get their posters and materials. Some of the posters you might have seen when you came in. This is one example of them. But these are going to be plastered in every school in the township. I'll talk about how that process works in just a minute. But every middle school, high school, public school, and private school will be having these posters, stickers, and cards distributed to students. So this is a service that's going to be available 24/7, 365, anytime a student might want. Here's what it looks like. It's really, really simple to use. All you do is you text a certain code to a certain number plus your message, and it connects you immediately to a clinician. We have two codes that operate in New Trier Township. NS5678 for students in grades 5 through 8, and NS912 for students in grades 9 through 12. And this is something that, through a collaboration with the township, this is what the township leaders and school educators and principals and municipal leaders decided made the most sense. So these are the codes that we're distributing through the township to students. And this is a great thing. So you see in the first example, NS Help 912, my friends are pressuring me to drink. Can you help? This is one we get a lot of times. So there's some obvious objectives and obvious reasons the text that might be used. We can think of the more serious ones like suicide, and I'll tell a story about that in just a minute. But on a day-to-day basis, what we see is students using it when they don't know how to get out of a situation. So it may be something as simple as I'm at a party, I don't want to drink, I don't know what to do, I can't sit here and call my mom. Can you help? So what our clinicians are trained to do in that case is reach out, try to give the students some skills over text, help them to get out of the situation by using conversation starters, by using some refusal skills, and if all else fails, we'll offer to call their parents for them to come pick them up where they are. Anything you can think of on that spectrum is happening. The example on the right, NSL 5678, I'm feeling depressed, can you help? What we see is students texting us for any possible reason you could possibly imagine. Anything from I'm feeling sad, I have too much homework, to I'm harming myself, or I'm thinking about harming myself, and everything in between. Our clinicians are specially trained to handle these conversations so they can help a student get out of the place they're in into a more cool, calm place. This system is not meant to replace any sort of existing relationship with a counselor. It's simply meant to get a student out of a dark place into a cooler, calmer place where they can get the next layer of support they need. Here's how it works. Very simple. The whole submission process takes 2 to 3 seconds. And I would suggest not all of you do this right now because we do have clinicians on call for real. But you take your phone, you enter NS Help 912 in a brief message. You can say hello, you can say is this Execut, you can say I need help, any message works. And you send it to a 6-digit number, 274637. What happens, I don't want to get too technological, but what happens is it leaves your phone, it travels to the messaging server from your cellular network or closest tower. It then sends it to our server, which of all places is based in the western part of Canada. Our server cloaks it, and strips it of all identifying information. This is why students use it. We don't have any sort of identifying information when our clinicians get it. No phone number, no geolocation, nothing. This is something that students told us was very, very important to them. They wanted fully anonymous. They didn't want to be called, they didn't want to be questioned, they just wanted to be able to make their report. And they wanted to be the ones to give the information if necessary. So it cloaks that number, it strips it of all identifying information, it sends it back to the tower, and then to us, into a place where our server can send it to our clinicians and they can retrieve the message. All that happens in a matter of seconds. Our clinicians are trained to respond within 2 to 3 minutes to every single text conversation. We audit that on a regular basis, literally multiple times a week. We go on and make sure that our counselors are responding in that time frame. And our counselors can get back on and have multiple conversations going with multiple students at any time. As I said, it's the only 24/7 text hotline in the country that's fully anonymous and that uses licensed clinicians. And now we have it here in New Jersey Township. Here's where we are. We started in Lake Forest in 2014, January of 2014, in response to the suicides that I just mentioned before. We didn't think that was going to go anywhere else. We wanted to safeguard our community and our kids. We marketed it really heavily in the schools. We got a lot of usage, and we didn't seek out to do anything else with it at that time. We got call after call after call. The first community that called us after we implemented was our neighbor in Highland Park. So a year, almost a little more than a year later, March 2015, about a year ago today, we implemented in Highland Park, Deerfield, and Vernon Fort Sheridan. That was the first external and outside of Lake Forest Lake Wealth expansion, the first implementation anywhere outside of our home base. Went really, really well. Now people started to hear about it. Soon, in August, at the beginning of the school year, it was implemented in McHenry County. Every single school, high school, middle school in McHenry County was operating text-to-tip. September followed, every single school in Lake County was implementing text-to-tip. And you guys, you're fine, but you're just under that border, so you weren't part of that implementation. And now we're starting to get calls from Cook County. I remember the first call I got from Debbie Van Zolcom, it was here somewhere, there she is in the back, the outgoing communications director. And we get a lot of calls like this, multiple times a week, if not sometimes multiple calls a day from all over the country. People hearing about text-to-tip and wanting us to implement it for them. Half of the time, I'll talk to the person on the phone and I'll give them all the information they need. And I can tell right away if this is a group that's going to be able to get it done or if this is a group that isn't. We do a lot of the work, but we have to have the connections in the community set up for it to operate effectively. Right away, for the very first 5 minutes on the phone with Debbie, I could tell this was somebody who could drive the process, and this was a township that could make that happen. And they did. I'll tell more about that story in just a minute. So the good news is now we're in Northern Cook. We expanded here just this past month, and we are looking at having other communities in Cook County follow the lead of the township here, and we're hoping to expand to other neighboring surrounding communities shortly. But the township really was responsible for making this happen. We also have a line operating in Riverside, California, which is our first expansion outside of Illinois. It's a test market for us where we launched it with an app, open to about 2.5 million people there. So the service is growing really, really quickly, and you guys are really in on the ground floor, and we're really excited about that. Really thankful that we have the opportunity to work with the township, and we're seeing students begin to use it as a result. So why are teens texting text-to-tip is a question I get a lot of times. This is aggregated for all of our communities that are using it to date. Number one reason is depression or anxiety. Students write in and they don't exactly know what they're feeling sometimes, but they say, I'm feeling down, I'm feeling sad, I'm feeling depressed or anxious. I don't know what to do with that, I need help. Now, we live in communities where mental health is not viewed as the same way as if we break our arm, right? If we break our arm, we know what treatment methods we need, we know where to go for that, and we get it fixed. If we have a sinus infection, we know who to go to help us get that fixed. But with mental health, sometimes that message gets muddied, right? There's a stigma in most of our North Shore communities that says mental health can be swept under the rug. The mental health is not okay. I don't want to be seen driving into the counselor's office. In the initial focus group I told you about a minute ago, there were students who told us that. My parents don't want to be seen driving me into a counselor. These are real conversations that happen here. Another reason why assessing something like this makes so much sense. So number one reason is depression or anxiety. Number two, relationship conflict. We get a ton of texts about students who are in a conflict with their significant other, their boyfriend or girlfriend, they're not sure what to do about it. Sometimes that is because of verbal abuse or physical abuse. Sometimes they're in a conflict with their parents, or they're trying to avoid a conflict with their parents, whatever it might be. Our clinicians are specially trained to help the student through that situation. Then substance abuse, self-harm, suicide, pressure, bullying, etc., and a whole bunch of everything you could possibly think of and more, and use sort of stories all the time. But the self-harm or suicide piece at 10% is a pretty alarming number. That's the reason we implemented text-to-tip. The other reason, I'm glad that other students are using it for other reasons, but that's the reason we use text-to-tip. For 10% of all of our texts, this factors out California, by the way, 10% of all of our texts to be about self-harm or suicide, is a concerning number to me. It shows that we have a lot more work to do, but at least we're on the right track. What I'd like you to do now is just get up and change seats if you can. It doesn't matter where, just get up and change seats. No, I'm just kidding, sit down. All right. You, sir, didn't even think about moving. Why not?
I'm old.
You're old. Okay. Fair enough. My wife didn't think about moving. Why not? She knew it was a trick, right? Why else? Sister Kathleen Donnelly, you didn't move. Why not?
I didn't think you were serious.
You didn't think I was serious, right? Yeah, we want to tell you what to do, right? So I've done this exact exercise in a lot of different groups. Young people, old people, you yourself included in that mix. Lots of different groups, and I always get the same answers, right? Number one, I didn't want to. Number two, I never heard I'm old before, but it counts. Number three, didn't think I was serious, right? Change is really, really hard. Implementing Execut is a significant change in a community. It brings about great change, but it makes us change the systems that we currently have. Change is hard for us as adults. It's even harder for young people, I think. None of us, 3 people in the room got up until I stopped the game, right? We're not even willing sometimes to change something as simple as changing our seat. But we're asking young people to change the way they're thinking and behaving all the time. But if they're looking to us to set that example, then most of the time we're failing at it, right? Here's what happens in a community when we implement Execut. It requires significant change. It requires a rethinking of systems. It requires us to think differently. But more than that, it requires the community to make sure we're telling students it's okay to feel these things, and we're showing them how they can do something about it. That's what's most important. From the very first conversations I had with the Township and the number of meetings we had to pull this together, I was shocked at how easy it was, and maybe it wasn't easy, Gabby, I'm not sure, but how easy it was for the Township to assemble all the necessary people. We had village managers, we had police chiefs multiple times, we had school principals and superintendents, we had all the necessary people that need to make this work. Because if there's not buy-in from the top levels of the community down, it's just not going to work. So you guys should be very, very proud of your Township for making that happen, because there are lots of communities that want to make it happen that can't. And that's the piece that we can't solve. That's the piece. We can come in and do the technology, do the training, and have a clinical team that's robust and really does a great job, but we can't network that thing together. So it's important that we tell students how these are things that you said that are flashing up on the screen. It's important that we tell students how we do, why we're doing this and how they actually do it and seek help when we need it. Okay. Here's the outcomes. There's 2 main outcomes to Execut. The first one is very obvious. The first one is that it creates an immediate intervention and prevention tool for students who are at a dark place, right? Students who are feeling suicidal, we can do something about that. We can intervene on that if we have the right information. Students who are injuring themselves, we can do something about that in the right information. Students who are being bullied at school at that exact moment, we can do something about that immediately by contacting the school because we have the relationship built. That's the obvious one, but there's one that's less obvious, and that's that it creates this community connectedness around mental health that didn't exist before. And that's what really I hope you'll see as a long-term outcome to Execut in your Township, is that there's this connectedness around mental health. So from the people at Loyola Academy to the people at New Trier High School to all the Catholic parochial schools and all the public middle schools and junior high schools, you're seeing this connectedness, everybody coming together for the same reason, for the same purpose, speaking the same language about this, all in an effort to keep our kids happy and healthy. That doesn't happen in many communities. And I'll take that a step further. The police, I think we had the police chief for every single municipality in the Township together, all talking the same language, all willing to take extra time and resources to do wellness checks when necessary when they come in through Execut. We had municipal leaders willing to spend the dollars. We had board members willing to spend the dollars that it takes to pay the clinical team to be on call 24/7, to pay for the technology and to fund that and to say this is important enough that we're going to keep it going. A lot of communities and townships can't do that. So here's where we hope to be by the end of 2016. We're already in Illinois and California. These are we have things already in the conversation started, and this is just the beginning. We're launching phase 2 of our software in the next few months, we hope, which is going to make things easier and cheaper for everybody. It's going to make it more accessible to students, and we hope to be in these 8 states by the end of 2016. Who knows where it will go from there. This is, again, the only anonymous text service in the country that uses licensed people to help. These are not concerned citizens, these are not parents, these are people who are trained to handle the situations. When I think about young people and the struggles they go through, especially in communities like ours, there's a lot of pressure and worry and anxiety and things like that. They really look to us as community leaders and as adults to help pave that way for them. And the township has done that in this case. The great thing about it is that the conversations don't always end with text-to-tip. They come to us and we handle the situation, but then we're able to align them to the next layer of service. I wrote these down because I knew I was going to forget them. There are 6 great social service agencies in the township that are huge partners in this. So Peer Services, Haven, Jocelyn Center, Family Services of Glencoe, Family Services of Wilmette, Kenilworth, and the Counseling Center of the North Shore. All these agencies have been a part of this implementation process and are going to be willing to have students come in when the student's looking for a counselor, because this is what happens a lot. When a student will come in and they can't find a counselor, or they want to find a counselor, their parent wants to get them somebody to see. They have insurance, but they can't get an appointment for 3 months, right? This is a real problem that goes on even in our more fluent, educated communities. Our social service agencies are going to be willing to work with us and make sure that those aren't barriers, right? To make sure that we can get a student seen when they need to be seen. We can work within whatever sliding fee structures there are. Without that process in place, it doesn't make sense, or the system doesn't work. I want to share 2 quick stories right from text-to-tip that I think highlights why this is important. The first one happened, it's one of the first couple weeks we had launched in Lake Forest. There was a student that texted in and says, "I'm concerned about my friend. She was acting strange at school. She says she's going to go home and harm herself, and now I can't reach her." Right? This is a call that this is the type of text we get quite a bit. So our clinicians go through our protocol that we have, and they'll number 1, affirm the student for texting in. "Thank you for contacting text-to-tip. You did the right thing. You're a great friend to be concerned about your friend." Number 2, validate the person's safety who's calling, and then try to get as much information as we can about the person they're texting about. Right? Generally, we have no information. So generally, the only time we have information is when a student gives it to us. We say, "We can help, but can you tell us some information about where your friend might be, where they live, or whatever?" In this specific example, we only knew it was a student at a certain high school, and they didn't know the address, but they knew that the person lived behind a store near a certain intersection, right? So our clinicians were able to drill down on that, call the police. It was right after school, maybe 4 o'clock, 4:15. The police department went and did a wellness check, because that's what our protocol tells us to do. We take every text as if it's serious. Police went in, no parents were home. The kid, the young woman, was in the process or about to start harming herself. And who knows how far that would have gone. She had the means, and she had the ideation of suicide. We were able to get her out of that situation, get her immediately into a treatment center, and call her parents. Without the connectedness around having the messages going out to her school, texting our line, to then having the police be able to do that, all that happened in a matter of 5 minutes. That's what makes the system work. An even bigger story. A couple weeks before Christmas, late on a Saturday night, about 9 p.m., in one of our county lines, we get a text, and it simply says this: "Partial first name, complete last name is going to shoot up the school." And an immediate opt-out. We have no other information. We know it's coming through the county line, so it's not one of the school lines. We can't drill down to a certain school. In 5 minutes, we were able to have 4 schools, district superintendents, 5 principals, 3 municipal police departments, and the sheriff's department on the phone with our clinical team. With just the partial name, we were able to have everybody analyze their records, find which student it was, send police to the house. The student had the means and a plan to carry out an attack at the school. Now, this is not the reason text-to-tip exists. It's not a crime tips reporting or a violence reporting system, but when a student has a concern that they don't know what to do with, this is the place they now contact. That's what we want. The police went to the house and worked with the kid, arrested the kid, and worked with the family. And we don't oftentimes get a report further than that, but we know that in this case, who knows what it could have possibly prevented, right? It's hard to measure what doesn't happen. But in this case, the student did what they thought they should do. They sent the text, they immediately opted out, which means we can't contact them for further information, but we had enough information that we're able to proceed with our network in that community to get the information we needed. Again, without the partnership of everybody in the community, in this case, a large county, knowing about text-to-tip and being able to have all those on-call numbers at our disposal at all times, That's the only thing that made us be able to intervene in that situation. So for those of you that live in the township, our clinical team has the on-call numbers, both during school hours and after school hours for every principal, assistant principal, police chiefs, municipal leaders, everybody you can imagine we might possibly need to call at our disposal at all times. And only use it when we need to and only in a small percentage of the time. But when we need it, where it's up to the network that the township has built, that we can access to be able to really keep kids safe. When I think about the theme for tonight, making a difference, and I hear what I heard earlier in one of the reports about, we're living in a climate where townships are questioned, should they be consolidated, should they even exist? I think New Trier Township has stepped up and said, here's why, right? Here's why we should exist. And I think about what a township should do, and a township tries to make the life of its residents better, right? In this case, I can guarantee you, because I have an example from it in every other community we've been in, the township stepping up and doing this will absolutely save lives. So thanks for letting us be a part of it.
How are you funded?
Sure. So funded differently in every single community we're operating in, but New Trier Township, this was funded through an initiative of the trustees of the township. So we worked with the township multiple ways. We wrote a proposal to the Mental Health Committee and the
Private
trustees.
donations as well?
Yes, we always accept private donations. Our private donations right now are going mainly towards increasing the capacity of our clinical team and then the new software implementation that we're working
Are
on.
you a for-profit company?
No, we're nonprofit. Yeah, LEAD is a nonprofit organization based in Lake Forest, and we do programs all over the country for young people.
Thank you.
Sure. Yes.
Do you have any answers when you don't get enough information on a suicide call? Do you
What's
have a
that, sir?
backup? If you get a suicide call and the individual doesn't give you enough information, do you have a backup to that?
Yeah, so the good answer to that is that it's never happened. 100% of the time since we've been in existence, when there's been a suicide or harm call of some sort, in 100% of the cases, our clinicians have been able to get the information from the student who's making a report. Oftentimes it's a student who is texting about themselves, sometimes it's a student, it's a third party who's concerned about their friend. 100% of the time we've been able to get that. Our clinicians are specially trained in this very thing. All of our clinicians are not just licensed, they're licensed to work with adolescents. And we have a certain protocol that we implement that says something along the lines of, I see that you reached out for help. I can only help you to the extent you allow me to help. So please, is there something you can give me that will help? And one thing I know about young people is that when they seek help in a situation like this, they typically want it. They just want to make sure that you're trustworthy first. So we always, in every single text, we build up that trust first. In terms of a backup plan, there's no way we can get identifying information. There's no way we can get any sort of geolocation. We're considering that for future implementations at the request of police departments, but as of right now, we can't. We're just trusting that when a student texts in, that they'll give us what we need to be able to help appropriately, and we're trusting our clinical team to be able to have the skills to draw that out. There are times where in a smaller community, we know that this code is only being used in a certain part, so we can kind of drill down a little bit, and we can try to call principals and see if this matches anything. But so far, to date, 100% of the time, we're getting the information we need. Yes?
Do you have, let's say somebody called and couldn't say them or whatever. Do you have like an insurance kind of a policy? Or
Oh, we have all kinds of insurance.
In
Yeah.
other words, you're not liable for it.
So we've worked with attorneys, we've worked with insurance companies, we pay way more for insurance probably than we need to or should. And each of our clinicians carries not only their own individual insurance that their license requires them to carry, we also contract directly with clinical practices who carry their own insurance, and they're all built into our umbrella, which if you knew how much it costs us, would be ridiculous. So, and we work very closely with our attorneys, and basically our attorneys have said if your clinicians do everything they possibly can to get the information, there's literally nothing you can do to get it. There's nothing you can do to be liable. Again, we work really hard, not because we're concerned about liability, because we want to save lives. This is probably the reason why somebody else hasn't done this yet, because it is risky, right? But it's a risk well worth taking because we know we've already saved multiple lives, and we're trusting our team to be able to pull out what they need in order to do that. But yes, to answer your question, we have all kinds of layers of insurance that's been put together by insurance and people and attorneys. Sure. Yes, sir.
In the township, we're really preoccupied with trying to measure outcomes. And, you know, especially we're gonna be fighting politically probably for our existence, and it's gonna be important for all our agencies to be able to document what we're doing and why it's working.
Sure.
And you gave some great examples where we can all feel quantitatively that you made a huge difference. I'm wondering what you do to try to measure outcomes, if anything, in those cases where everything is completely anonymous. And, you've given advice, but you don't know whether it's been effective or not in ameliorating the problem. Is there some way of following up and trying to measure the outcomes in those situations?
Yes, we do it the best we can. So we have a really robust online reporting tool that's HIPAA compliant that our clinicians use. They do those reports after every weekly shift that they're on call, and they filter to us. And our clinical team or our clinical director actually reviews that on a very regular basis, multiple times a week. So part of our reporting tool says, was there follow-up, we don't call it advice, I forget exactly what it's called, but was there follow-up suggested? The follow-up might have been walk into your school counselor and ask them for an appointment. It might have been go see a private counselor. It might have been something else, but they always record what sort of, skill or impact or advice was given, and then was there follow-up. Our clinicians are trained in situations like that to follow up the next day as long as the student hasn't had any sort of, if the student opts out, there's nothing we can do. Very few times do those students opt out. So we'll be able to go in and say, hey, did you go in and talk to the counselor? Did you go in and have a conversation with your parents? Anything you can tell us? And oftentimes the students will write back and won't give us much detail. They'll say, yes, I did, and we sort of check that. We always keep track of how many we've referred to an outside agency. We always keep track of whenever we've called the police or principal or school. So we're measuring outcomes based on that data. And we always report that data back to the community too. It's one reason why we use various codes for various places and municipalities, because we can say, with the 5678 code that we have here and the 912 code we have here, we can filter that most of these texts through the 5678 are coming for middle school students, most of the 912 are coming through high school students, so we can look at trends that are developing along that data. So what are the reasons why middle school students are using text different versus the reason high school students are? We give the data in the community. We give the community and the schools all that data on every 60 to 90 days, depending on the program. Yes.
I'm curious what it's hard to measure because you don't really need to measure in the cost of the police department or the principals, but how much does it cost per call? May sound crass, but I think it's a bit.
How much does it cost you?
No, per call, or per contact.
That's great. So we have a formula that helps us determine that. And I don't have it in front of me, but it's different in every single community. So the vast majority, the bulk of the expense is the clinical expense. It's keeping those clinicians on retainer 24/7.
And the insurance, perhaps?
And insurance, actually, insurance is not even something that's built into our cost because it balloons so high. So we're having to build it in cost for sure. To be honest with you, leaders assume most of that expense for all the communities. But so the clinicians are the bulk of the expense, and it's all based on volume. So we work our pricing based on the expected volume. So we can plug a population in based on our aggregated data to date, and kind of generate what we think based on the student population in the community, how many calls we'll get per day, or we can even do it per capita, and we put a price on that. In some communities, they get very few texts, but those that they do get are pretty serious. In some communities, we get a lot of texts about things that maybe aren't so serious. A lot of that depends on how the schools are messaging and integrating that into the life of with their students. So some schools are saying, text anytime you have a concern, text. That's fine with us. That's fine with us. Some schools are saying, well, go to your counselors or somebody else if you don't have a serious issue. If you have a serious issue and it's out of hours, then contact us to tips. So that's what we see in those communities. So it all depends, but the vast majority of the expenses.
So you don't have any figures, though?
I have figures. I don't have them with me because I wasn't expecting that question.
Are we talking $200 a call?
$200 a call? No, it's somewhere in the 25 to 50 range. In some communities, it's much less than that. Like in the McHenry County line, it's much less than that because we get a ton of usage and it's a pretty large population. So but in the North Shore, I would say it's in the 20 to 30, 40 range per call. But that cost is going down per call as the volume increases.
Are you using counselors that answer calls from all over the United States, or they only address one community?
The way that our model works is that we are having counselors that are local to the community. So that may not mean that they're all in New Trier Township, but they're all in the general North Shore area.
So they understand.
That was really important. Same thing with California. We're using a California-based team there. Same thing with Florida. We're using a Florida-based team there. The reason that's important is because they know the students, they understand the the student in those communities so they can better help, and they also know the next layer of resource to send them to. So that was very important from the beginning. Actually, students are the ones that first alerted us that was important, and I didn't think students thought about that sort of thing. So they said we wanted, really professional people doing it, and ideally people that know us, which was very exciting and fun. Yes.
I'm from the state of Washington, and I am curious about northern Washington, northern Idaho, and Montana.
Yep.
And if you are able to set up the same kind of system there.
So Western Montana, we already have in the works in the Missoula area, probably up in Helena as well. We haven't hit the Idaho Panhandle or state of Washington yet, but Spokane is a target area for us, so it's possible that that'll be one of the next implementations. But Montana will probably be there. Yeah, sure.
With the data that you have on your existing calls, what's the average range of duration of another call?
Great question. It's a great question.
Is there a maximum?
Yeah. So for whatever reason, our text conversations average 8 to 8.5 or so texts per call, and that's just on the client side. So the client, the student, will send in the course of the conversation about 8 to 9 texts. It's a great question. So now that's an average. So some are much more than that, some are much less than that, but typically it's 8 to 9, which shows you that it's not something that's typically taken care of in just a short exchange. And a lot of those are, the student wants to build up trust. They might say one reason they're calling, but the reason is actually greater than that. They just want to get to that. So yeah, about 8 to 8.5 or so per call. Brian?
I would mention, I mention I think every time we have is one of the great things about this service is that if a kid texts in and then say 8 to 10 texts are exchanged, and then a month later another text comes in, the service will pull up all of the previous texts so that the social worker has a history of what happened, yet they still cannot identify the client. That is a fantastic piece of technology and gives the social worker a little bit of history and perspective on this kid.
Yeah, because it might be a new person and a different person on call the next time, so it does give them history, right? That's a great thing to bring it up. Yes?
So you said all the clinicians are local. What if the student doesn't put in that code? What happens then?
Even if they just text the number and no code,
Yeah.
it never hits us. It doesn't, the technology doesn't work that
So
way.
the code has to be there.
Code has to be present. Yeah, that's how most like if you go into Target actually and they have a special deal that says text Xmas to Target and you'll get a coupon, like if you don't have one of those pieces present, it stays the average space somewhere. You gotta have both the code and the number. But we do get texts from students who might live in Lake Forest, but for whatever reason have a friend in Winnetka and text this code instead. That's fine with us. It all filters to a similar team and same protocol, same system, same organization, us. But when we give resources based on where we think they're calling from, and they'll say, well, I'm not there, then we readjust. Or what we're seeing now, because we're growing, we've been around for 2 years now, we're seeing students go off to college. Just recently, actually, we had a student use the Lake Forest code, which is 847 help, and through a long, 20 or so text long, got the student the information they needed, but they really wanted to see somebody, didn't want to see somebody at college or at school. The word they used was school. So we assumed they didn't want to see a counselor at Lake Forest High School, so we gave them 3 agencies we trust in Lake Forest and Lake Bluff. They said that I'm in Champaign. So, they assume we know that, but we don't know that. So then we quickly got on, and we know people across most of the state, and found 3 people that we trusted in Champaign and sent them there. So we've had people drive by and see community signboards. We had someone text the Lake Forest code recently, and they live in Kenosha. So there's all kinds of things. You don't have to be present in the community for it to work. Anybody can text any code at any time.
How do you go about getting your clinicians?
Yeah, that's the hardest part. Luckily with Lee, we already have a lot of those relationships built for the work that we do. So the initial part wasn't around here. It's not hard. We know a lot of people. We've got backup teams and C teams, and D teams, and things like that ready to go. It's harder in the other communities. It's harder in the states where we don't have that network built. That's one thing that's delayed the California launch so long. That and the labor laws. So like we're learning new things about every state. It's causing some things not to work as quickly as they have here. But we recruit heavily. We pay well, so that's an advantage. And that's important to us is that we have that relationship. So we recruit heavily for it. These are great questions, by the way. You're in deep. Anything else? again, thank you to the township staff, thank you to Patty and her team for allowing this to happen, thank you for Debbie for initiating it, thanks to Jack for working on the marketing materials for the schools, thanks to the schools and the community partners and everybody who's been a part of